Right, earlier we looked at the vaccine rollout across parts of South Africa. Let's look at the continent that we live on. The World Health Organization's Covax facility was expected to deliver vaccines to Southern Africa today. Vials to be shipped to Angola and Lesotho. Earlier vaccines procured through Covax, this joint procurement platform, were delivered to Ghana, the Ivory Coast and Nigeria as well. And but later on we'll speak to our correspondent in Kenya. They are expecting some deliveries at midnight tonight. Well, to discuss, we're joined by UNICEF spokesperson James Elder. Mr. Elder, thank you for being with us. So Lesotho and Angola, what happened today? Was it a good day?
Yeah, look, it's a great day. It's a day that everyone has been working to for a long, long time, from the mums and the dads who've been enduring this pandemic to the frontline health workers who've been putting themselves at risk. Today is a great day. It's a start, obviously, as you said, Lesotho, Angola. We've got Kenya coming, Rwanda soon, Nigeria, Ghana, Cote d'Ivoire. The aim is for 2 billion vaccines to be rolled out this year across these countries that are part of what you said is this Covax facility. Very quickly, that is a facility by WHO, by UNICEF, by the Global Alliance for Vaccines to make sure that everyone gets access to the vaccine, because we know that there is no cure to this pandemic until everyone is protected. So today has been a long time coming, although in a scientific sense it was pretty quick, but it's been an enormous effort, and it's a very good one for those frontline health workers and most at-risk people today in Angola, Lesotho, Nigeria.
Okay, so how many were delivered if we look at Angola, say, and compare that to the population and the need?
Yeah, exactly. So Angola today, first batches, of course, 600,000. The idea population, 25 million, 30 million. So the idea at the moment is, of course, first and foremost, we are looking at frontline workers and the most vulnerable. That's the same as most populations around the world are doing. The idea of COVAX is to make sure that every country gets some vaccines for that. Frontline workers can also be teachers. This gets kids back into school. So Nigeria had 4 million. Obviously, it's got a much higher population. So it's a great day, but yeah, as I say, it really is just a start. We're very grateful to the countries who are part of this, to the big donors, the EU, the Brits, the Americans, but it's a beginning, and there is still a problem with equitable distribution. Some countries, rich countries, are getting more, but what COVAX is promising is we will get vaccines to all countries, no matter what their income status.
Yeah. At what pace, though, looking at this in the context of the billions on the African continent that need it?
I guess two parts. Hey? On one hand, an incredibly quick pace in terms of science. I mean, what a year for science. What a horrible year for the rest of us. But in terms of scientists and showing what people can do, the speed of this vaccine is incredible. Then you have an organisation like UNICEF that's able to procure it, to get it, to ship it. That's a huge effort. And then to get it on the tarmac so it gets to ministries of health. So that's incredibly good news. But then on the other hand, as you say, rightly, we're looking at 2 billion. Today is a very humble beginning. It's a critical beginning, and we're pretty quick. I don't think anyone thought we'd be here, in the start of March. But the next 3 months are critical to double, triple, quadruple what we've seen today in those countries.
All right, unfortunately we've run out of time, but thank you for that quick update. Yes, Southern Africa now in the mix in terms of receiving the first vials of Covax vaccines. That was UNICEF spokesperson James Elder.